What is up, you guys? This is For the Femmes podcast. I'm your host, Faithlynn, and today we're here with a really exciting guest. We have Jack joining us, who is a traditional Eastern medicine doctor, and I'm so excited. Thank you so much for coming on.
Thanks for having me.
Yay. Okay, so obviously this is very exciting for me as I do this rebrand. But also the really fun part is that you're also queer. Let's talk about what initially drew you to Eastern medicine.
Yeah, my story is very much like burnt out tech startup employee. And I knew it just became obvious to me that I wasn't going to be happy until I was working in holistic wellness. That was my interest, it was my passion. I wanted to be doing it every day.
Mm.
So I started looking into ways of doing that. I wanted some kind of graduate degree, and I thought I wanted to do nutrition, but I didn't believe in the whole I didn't want to do several years of calories in, calories out kind of education. I knew that would make me mad,
Yeah,
honestly. So I wanted
understandable.
something, yeah. So I wanted something that was more about food as medicine. And then when I was looking into traditional medicine, types of modalities, then I was looking at Ayurveda, which is not super standardized still here in America, and
Mhm.
Chinese medicine actually is. So like acupuncture school is a 4-year graduate program, that's only a master's, and then I also went back and got a doctorate eventually. So I was sort of a trust fall because I was afraid of needles. I was like, I don't even think I'm gonna do the acupuncture part. I'll just be a Chinese nutritionist and I'll do the herbalism, and those will be my tools. But I fell in love with the acupuncture, and that's my favorite tool that I have now.
Mm.
So I kind of got lucky. I quit my job. I was chief of staff of a cybersecurity firm, and I started school, and I
Oh
just
my
went for
gosh.
it. And I was like,
That's
am I
so
really?
inspiring. I
Yeah,
love
it was.
that. Oh
I
my
was
gosh.
worried, but it was the right choice. And there's new reasons every day why it's like perfect for me. I love the tools that Chinese medicine offers. It really is like I have so many different modalities to treat so many different things. I feel like there's an answer for everyone. Even if you're afraid of needles, there's acupressure, there's ear seeds, there's cupping. There are so many ways to treat people. And I love all the tools that I have.
Yes. Could you speak a little bit about the difference between just being an acupuncturist and someone like you who's a traditional Chinese medicine doctor?
Sure. So in the States, to be a licensed acupuncturist, you need a master's. And that is very comprehensive schooling here in California. My program was a 4-year master's program. And they're lobbying to make that a doctorate just because, chiropractors go to school for 4 years, medical doctors go to school for 4 years. It really should be a doctorate. But currently, you do have to do more schooling to get that doctorate. And to be honest, it doesn't change your scope of practice at all. It really is
Mm,
just a title. So it's
mm,
sort of like, it makes you sound more official to people sometimes. It
okay.
was additional schooling, but we're all required to do continuing education anyway, just like any other professional licensure.
Doctor. Hmm.
Yeah, so like we all get so much education all the time that the doctorate is not necessary, but it does mean that you have a little bit more like research focused education. Um, you know, but we all take the same board exam. It's honestly very
Right.
similar.
So, can you talk a little bit about the history of traditional Chinese medicine, where it began, and then how it came over to the States?
Yeah, actually, I did a post on this recently. So, just in light of all of the drama over
Chinese
immigration.
baddies on TikTok.
Yes, of course, that too. So, yes, it is traditional, like millennia old medicine, right? This was their, it was like really a lifestyle. So, when you say Chinese medicine, it encompasses like keeping your feet warm. Like, that's medicine to us, even though that's something that, it's these things that you think of as like grandma medicine, things that like the older, wiser people in your family would tell you to do. That is part of like traditional medicine.
Mhm.
So, yes, it started in China. There is some like a lot of it overlaps with other cultures. Like a lot of stuff that Chinese medicine says overlaps with Ayurveda or traditional
Mhm.
like American medicines. But eventually it came over to the US. There was something with like a New York Times reporter in the 70s who got acupuncture for some kind of digestive, maybe like appendicitis or something. And it really helped him. So he reported on it, and everyone was like, whoa, what's acupuncture? Never heard of that. That sounds like crazy. And so it became a little bit more popular, but there was no licensure program. So then, like the Chinese immigrants, of course, there's a long history of racism against Chinese immigrants. And
Mm-hmm.
they barred them all from medical school and said, no, you can't practice medical things like that here. So they kind of like, gave it to medical doctors, and medical doctors would just pick up whatever they knew about acupuncture and do it
Mm-hmm.
separated from that Chinese medicine. So there's a lot of like, colonization of
Horrible.
the
It
medicine.
happens. Yeah.
It's a
It's
mess.
horrible.
Anyway, after, they were like arresting people who were just practicing their traditional medicine system in America, these like Chinese immigrants, which is awful. And there was actually, in the legalization of acupuncture, the Black Panthers played a role. So it's all
Mm.
these different cultures that like made
So,
acupuncture legal in
yeah,
America.
it's
So
amazing.
yeah, really grateful to all of those people who gave me this career and made it possible,
Right.
because
Push so
like,
hard.
yeah,
Yeah.
people need this medicine.
I can't even begin. Like, I have always been very well versed in the holistic health world. I've tried Ayurveda, I've tried traditional Chinese medicine, but starting in 2025, I was just like, every single week I'm going to see the Chinese medicine doctor. And within maybe 3 months, it completely changed my life. But it did really become a lifestyle for me.
Yeah.
And obviously that helped a ton. But I I have seen many doctors, I've seen many therapists, I've done many different things, and this is like truly what changed my life a lot and why it was so important for me to have you on to talk about this, because I think if you walk away from one thing from this episode, like, of course, I'm sure you're going to share a lot of little tips, but please book an appointment with Jack if you're in LA.
I love that. Yeah, I hear that all the time. Chinese medicine is something that people seek out after they have tried everything else. I hear that all the time. I've tried everything for this back pain, for my PMS, for my headaches, whatever it is. And
Hmm.
Chinese medicine really works. And the lifestyle things that, like the lifestyle tools that it gives you, are doable. And they're like
Right.
usually free. And they're things that you can just implement into your life and feel so much better. And yeah, it really just makes sense and fits in for people.
Yeah, and it's not just about going every week and like getting acupuncture or getting cupping done. It's also about waking up in the morning and having the warm water, or
Yes,
being in tune to understand like, okay, I need to cool my body down right now because it's too hot or there's too much heat in the body. And like once
totally.
I learned all of the lingo and how to develop that intuition inside, things shifted so much. And I hope you guys can get a little glimpse of that today. Okay, yeah. So let's get into this. So what's the core philosophy of traditional Chinese medicine?
Yeah, so at the core of it is yin and yang. So you've probably seen the symbol. Yin and yang is just about the balance and duality of everything in life. So, like you kind of mentioned already, heat and cold. Everybody has, like, some people run really, really cold, some people run pretty hot, some people are more neutral, and that's good balance. So, if you're someone that runs really hot all the time, you should. You have to eat 3 meals a day. When you're eating food, you should think about what foods are cooling for me. And that's getting towards that balance. Or if you're someone that runs neutral, when you're eating something like sushi, sushi is cold raw fish, right? It doesn't get colder than that. And I'm talking about the physical temperature, but I'm also talking about the energetic temperature of foods.
Yes.
So,
Yes.
along with sushi, like the cold raw fish, they give you ginger, which is warming. Even though it's cold and pickled, it is warming. And then they give you wasabi, which is spicy. And that
Mhm.
is warming, even though, it's room temperature. So, with those things, you are balancing out the cold and raw of the fish. And then some restaurants will even give you shiso leaf, which is a leaf, and that is a Chinese medicine herb to prevent seafood poisoning. So, all of that is a very balanced, very safe meal. Even though technically
Mhm.
sushi is cooling, you can make it balanced. You can do that with anything. It can be like ginger dressing on your cold raw salad, it could be cinnamon in your frozen smoothie. We're always just
Mhm.
looking for balance.
And why do you think it's important to keep the balance? For me personally, like I have so much heat, and not necessarily that I feel physically hot all the time. If anything, I actually struggle because I feel cold, but internally, there's a lot of heat going on in my body energetically. And that also is attached to anger, right?
Like,
And
I
anger is something, I'm just human, I'm processing, and but because of that, I do try to eat really cooling foods, especially if I can feel that energy, if that makes sense.
Exactly. So one thing that you're kind of talking about is anger. So all the emotions are huge in Chinese medicine. That's one of our main
Yeah,
pathogens. Our pathogens are things like, the
that's my
warm body.
language.
Yes.
Like, that's how I can understand things, so
Yes. So pathogens are things like weather, so like heat, cold, dampness, whatever. And they can also be emotions. And emotions take a physical toll on us. Like if they get stuck in our body, and now, all over my TikTok algorithm, it's like emotions get stuck in your fascia. I'm like, glad
Yeah.
you guys figured it out. Chinese medicine knew
Yeah,
about that.
right.
Welcome
Yes,
to
but I'm
the
so happy that people are, like, finally waking up and learning about this stuff because this is honestly the only way we're gonna change society collectively. So,
exactly.
I
We
am so
need
here for it.
Yes, speaking of balance, we need a balance of everything. Like, yes, we
Yeah.
need Western medicine, but Chinese medicine
Yes.
answers a lot of questions that Western medicine doesn't. So it really is
Mhm.
that holistic kind of cherry on top to be able to see everything and know why everything is happening. But emotions all have directions. So anger kind of like makes things rise up. When you get angry, it kind of goes to your head. Maybe you get a headache. Maybe your face gets red. Yes, it is heat rising. In Chinese medicine, we even call it liver yang rising. So that's that yin and
Mhm.
yang. It's coming from the liver. That's the emotion of the liver, and the heat rises upward. It can also cause things like red eyes or high blood pressure. Like there are these patterns that happen in the body that cause so many symptoms that Western medicine would say, I don't know why you have that. That's not connected to your anger. In Chinese medicine, yes, your high blood pressure and your red eyes are connected to your anger.
Yes.
So
It's
we're
really
just
cool.
grounding it. Sorry.
Definitely. I always feel like for me, kind of like a rule of thumb is to use Western medicine for like an emergency or something if something's very serious. But I
Yeah.
always gravitated toward Eastern medicine for like as a whole, for women's health, for day little things like a cold, things like that, to keep my immune system healthy. I always gravitate toward that. And I feel like I've been a pretty healthy person. I think the
Yeah.
trap, unfortunately, sometimes people can get into is, and this is just not like not really taught in allopathic medicine, but they treat the symptoms. But our bodies are so complex, and that's why it's amazing how in Eastern traditions they has always looked at the body as a whole, and like we really are missing that here, but. Again, I'm glad that there's this new curiosity and awareness.
Definitely. I love that Eastern medicine asks why. When you go to a,
Mm.
traditional biomedical doctor, then they are asking which one of these pharmaceuticals quiets that symptom that you have. I'm asking, why do you have that symptom? And where is it coming
Yep.
from? And what do we need to balance so that it stops? I want to stop the symptom too. And sometimes you have to give a treatment like an herbal formula or whatever that stops the symptom. And sometimes pharmaceuticals are the best way to do that. But
Hmm.
I need to know
Yeah,
why it's
an
happening.
infection or like
Yes,
something like that. Of course, like
all
we
kinds of stuff.
have science and modern medicine for a reason, but
Yeah, but
still
you have to ask why.
yes. What are some common patterns or symptoms you see typically within queer women?
Yeah. So, one of the most common ones that we would probably refer to as nervous system dysregulation, because a lot of my queer women patients are, recovering perfectionists. They are the burnt out people pleaser, those types
Mhm.
of people. I see a lot of liver chi stagnation. So that can look like PMS symptoms, any kind of PMS symptoms, because in Chinese medicine, PMS is not normal. You should not have cramps. You should not have irritability. You should not have sensitivity, like emotional changes before a period. Um, and really, any of those things are not a sign that something is really, really wrong, but it's something that we want to work on. And it's a sign that
Mhm.
the liver is not functioning perfectly. So, liver chi stagnation is really our diagnosis for stress. And a lot of my queer women patients are under so much stress.
Mhm.
And so, what we're doing is just allowing that liver to circulate the chi more easily. That includes the circulation of emotions, that weight on your shoulders that people feel like they have shoulders up to their ears by the end of their workday. They get jaw tension because there's things that they're not speaking up about. Tension anywhere in the body is liver chi stagnation and poor circulation. So, we're going to do cupping, we're going to do acupuncture to get that moving again so that you don't feel like you're bottling so much up and holding so much in. Um,
Mhm.
People also notice like acne at certain points of their cycle. That can be a liver symptom. Like you said, anger and irritability and frustration, those are the emotions of the liver. They're like, I am such a nice patient person. Why do I lose it? Why do I have a short
Yeah.
fuse? And it's not your fault. Your liver just needs some help.
Yeah. No, literally. When I started taking the herbs that I was prescribed and doing warm foot baths,
Yes,
cupping, all the things, it really shifted so much. This was the first period I had where my cramps weren't that bad. And so I'm like, okay,
good.
I'm getting somewhere.
So another thing that the liver can do when it is overactive and so full of, holding on to all this stress and these hormones that it can't detox and all of those things, that's the liver's job in Chinese medicine. I want to acknowledge that I know that that's not what Western medicine says it does, but in Chinese medicine, the liver is a busy organ. And when it's overwhelmed, it's going to overact on the spleen, which is our main digestive organ. And then you're going to get that kind of like nervous IBS, upset tummy, like, that anxious, like have to run to the bathroom or don't go to the bathroom for 5 days. That pattern is from liver chi stagnation and stress. And I see that in my queer women patients all the time.
Hmm.
So that's a really common one.
What would you say to women who are just now learning that their hormones shift every week and they thought that their whole life that, oh, cramps are normal? Like, how do you even have that conversation with somebody who was kind of conditioned to believe this?
Yeah, that's a really common thing that I am teaching about. I do a
I'm
lot
like,
of nutrition
whoa, I
education.
wouldn't even know where to begin.
So, one thing I do is on my intake form that every single one of my patients fills out, I ask so many questions. The intake form probably takes 25 to 30 minutes. And that to me is like a crash course to these new patients that don't know me yet, know how I work yet, exactly like they see kind of what I'm interested in and they see, oh, why would you ask about if I have dry eyes? Can you even fix that? I'm like, yes, everything is connected. And that
Yep.
is like an early explanation for here's why I'm interested in everything because I want to find the one or two or three root causes that are making you experience these symptoms because they're usually all connected and I want to treat that. And then everything else kind of disappears as a side effect almost. Like the side effects of
Hmm.
acupuncture are like, oh, wait, I'm going to the bathroom every day. I'm sleeping better. I'm more emotionally level. Like
Yep. Yep.
those are the side effects. So, yeah.
That, and I am not encouraging anyone to do anything they don't feel comfortable doing, but personally, like, again, living more of this lifestyle and being consistent with treatments did more for me than any medication I've ever personally been on, to be honest. And like eating 3 meals a day, going to bed at the same time every day. And unfortunately, I feel like that's a conversation that a lot of people don't want to have.
Yeah.
And that's not to say that like, oh, get off medication. It's just to say, okay, well, like, have you tried all of this? Have you tried balancing your lifestyle in general first and then that maybe, or maybe even both, you'll feel like $1,000,000 then. Um,
Exactly. Yeah,
yeah,
and I'm not a practitioner that's ever going to encourage anyone to stop taking a medication that they're on,
correct.
but I have a
Correct.
lot of patients who are like, I'm thinking about trying this medication, and my recommendation is always, unless there is something urgent, if there is something urgent, I'm going to tell you that you got to do what you got to do, and I'm never going to judge you for it,
Of course.
but
Of course.
I'm going to recommend the lowest risk intervention first, and that's going to be acupuncture, herbal medicine. Herbal medicine is like so balanced. They are so like these classical formulas are balanced to not have any side effects,
Hmm.
So it is so
Yeah.
much just safer and they're really well researched. People don't realize that they're very well researched. Chinese medicine is absolutely research backed and evidence based. Um,
Hmm.
but I like a low risk intervention first if I have to try something. Like my dog has anxiety right now. And I'm like, I
Yeah.
know that I could take her to the vet and get her Dramamine, whatever they
Correct.
give to dogs.
Yeah.
I don't even
Yeah.
know what they give to dogs. But I'm gonna try treating her first with a little bit of acupressure and see if I can
Hmm.
make a difference first.
Absolutely.
Yeah, why
No,
not?
I think it's amazing. I think as more people are getting curious and more people are learning about this, I think that will possibly be the go-to. It just also makes more sense. Can you share a little bit about how emotions get trapped in the body when we suppress them and don't fully allow that cycle to happen?
So, in Chinese medicine school, one of the first things that we learned was about emotions. And one of my teachers said that there's an old saying emotions should come and go, but don't serve them tea. Which means don't become a host for these emotions. They should be fleeting. It should be a momentary experience. They should leave your body. For some reason, we think it's responsible or like, I don't know, strong of us to hold on to these emotions and shove them down and not ever let anyone see you have a moment of being messy. But really, you have to process them and you have to let them go. And there's a lot of ways to do that. Acupuncture is my favorite one. It's kind of like a low barrier to entry one just because I'm not going to make you like dive deep into it. You might cry a little during the session, but you can
Mhm.
finally let it go. Acupuncture can help to guide that out. Other things that I do to let the emotions come out would be somatic therapy has been a big one for me.
Mm.
Really, really love that. And my therapist will say, "You're feeling some anger right now. Let's get up and move it." And I'll hit some pillows or I'll shake my body like an animal does after a stressful situation.
Mhm.
There's also things like qigong, which is, the traditional Chinese medicine approach to somatic movements and exercise. There are so many ways to get your body and your chi moving because if you don't, the emotions will get trapped in there. And
Mhm.
journaling is another great one. You can always journal them out. But sometimes language doesn't touch it, and you need something physical because it does get trapped in your fascia. And in Chinese medicine, we call that the sanjiao, which is an organ, and it just kind of gets trapped in your fascia and your lymph. It gets stored in the face as like heaviness or repeated expression that causes fine lines in the face. It gets stuck in the body as disease. So it can really look like a lot of things, but doing emotional labor and processing and release is like the best preventative medicine that I can think of.
It's it's life-changing, and again, I feel there is this newfound curiosity behind emotions and how it gets stuck in the body. This new curiosity, I just started somatic therapy. I was doing EMDR therapy, and I feel like I'm a crier, so I never really understood. I was like, "What do you mean I'm suppressing my emotions?" Like,
Mm,
I cry and I allow that space for myself. But for me, it was the anger. I didn't
mhm.
know how to healthily express anger, so I would just hold it in and just breathe or, walk away from the situation I didn't allow myself to feel that, but I think every single emotion is so crucial for us humans to feel and to experience life at the fullest. And I think anger actually is a healthy emotion when expressed properly. It can help you through a breakup or it can help you through X, Y, and Z. You never know. But for me, and I noticed too, like you said, with animals, with my dog, like after something happens with my dog, if she's playing with the other animals, she'll like shake it off. And I'm like, okay,
Yes,
I need to start just like shaking it off, literally, just
exactly.
shake it out of you. And I know that that's like very well known, I guess, in the TCM space, but it's definitely new to me.
I love that you're making that designation. Yes, being emotional and releasing your emotions is not as simple as just like crying during, a disagreement or during a hard time. It is so much more than that. You have to really dive in and say, what am I feeling and where and why? And where is it coming from? And what do I need to release it? So yeah, I love that you brought that up. And I love somatic
Yeah.
therapy because it really provides a container, like a safe space to express anger. So you're not like, bullying someone else. You're not I'm not saying
Yeah.
that you have to
Yeah.
take out your anger on other
Right.
people, but when
No,
I'm
no,
like
no,
hitting
no.
my pillows, that's a safe place for me to get it out. And then the next time I see that person, I'm like, I feel neutral now. I feel better. I've moved past
Yeah.
it.
Because you expressed it and you let it
Yes.
out. Because if you don't, you just hold it on inside of you. And I'm just gonna be real, guys, holding on to these angry, nasty emotions that don't feel good, it makes you ugly. Like it really does. As soon as you start allowing yourself to feel and getting curious and wondering why you're feeling this way and saying that it's okay is huge. For so long, I think most of us were raised probably where we weren't allowed to have emotions, or there was that saying that like some parents would say like, cry, if you're going to cry, I'll give you something to cry about, like
Yeah.
to just shut you down. And I think we're so many generations of that finally we're like, okay, this is not normal, it doesn't feel natural, so I'm going to stop doing that.
Yes. Exactly. Or pretending
Thank
like you
God.
have no emotions. Yeah. When you can
Yeah.
finally figure out how to process and release those emotions, to me, it feels like freedom. I was like, oh my God,
Yes.
how was I doing that for so long?
Yes.
And does
Like
everyone else do
literally.
this? How are we? Are we okay?
How is this not talked about? Like, I'm like, this, everyone needs to know this.
Yes.
Gosh, it's really powerful. And honestly, there's nothing more like not attractive than a nonchalant type of person. Like, I'm
Yeah.
sorry. Come on. Let's
Well,
leave that in 2025.
and when you try so hard to play it cool, this was something that my girlfriend and I dealt with kind of like early on. She
Yeah.
was so like calm, cool, collected all the time, and just like, if anything serious came up, like make a little joke, get out of it. And I was
Yeah.
like, I feel like we're missing some intimacy and vulnerability here. Like I actually need you. I need to know what you're feeling. That's
Yep.
actually hot to me. And it's,
Yeah.
in the crush stage, it's cool to be like, you don't want to
Yeah.
show too much. You want to be responsible with your emotions. But once you're deepening a relationship or a friendship or whatever it is,
Yeah.
you got to show them your cards and work through it with other people. That's co-regulation.
Yeah. Vulnerability creates connection, and like you said, in any relationship it's so important. And yeah, I'm just like so over the idea of like holding emotions back, or oh, you shouldn't feel that way. Like, I hate that word, shouldn't. You should or shouldn't. It's like, well, if you feel that way, that's okay. Let's just
Yeah.
get curious about it, and that's really all that matters. Part of the reason my journey into this medicine began a few years ago in just this holistic medicine world was because I got really sick after my first heartbreak.
Mm.
And I've worked through a lot of those symptoms now, but it's been such a journey. And my first heartbreak, unfortunately, I mean, we're like friends now, but unfortunately, she cheated on me
Oh,
when I was in high school. And that affected me so much in my throat. I got a crazy virus and it basically just like took over my whole body, but really manifested in the throat.
wow.
Now learning what I know now, I do feel that there is a connection, and I was wondering if you could speak on that and how we hold emotions in the different organs.
Definitely. So there are a few different channels that run through the throat area, and I'm sure this is connected to. I'm not super well versed in chakras, but I'm sure it's connected.
Okay.
And if you were a yoga teacher, you know about the chakras, I'm sure.
Yes, yes, yes.
so, so when I think of throat, I think of, speaking up. I think of, things left unsaid.
Yeah.
And yeah, the words that were, untrue and taking that in, hard to swallow. The channels that run through the throat, one of them is the liver, which, would be a storage place for those viruses and, would
Mhm.
cause that heat and anger. And then now you're dealing with, like
Yeah,
circulating anger that you're wanting to release. So, I mean, there's a lot of reasons why that could happen. But
yeah,
yeah, that's so interesting. A lot of people actually say that they get really sick after heartbreak. And yes,
yeah.
like not only is it heart pathology, it can be other organ pathology as well. But I hear that really often.
Mhm. Okay, so let's another thing I want to talk about is cupping because I love it so much. I love it.
Yes.
I think I love it personally more than I love acupuncture, but cupping for me, like just being the kind of like young leaning person I am,
Yes.
it's definitely my thing. And when I first started, I'll show you pictures, or I'll probably put them here. My back was so, like, black and blue, beat up, so, so, so bad. The more consistent I've been, it's, like, really not as bad,
Right.
and I'm like, "Oh my gosh, this actually works, you guys."
Yes.
Can you
Exactly.
share a little bit about cupping and what it does?
Yeah, so in traditional Chinese medicine, a lot of practitioners use glass cupping, or glass and fire cupping. So, what it does is it moves stagnations. If there are any stagnations in the body, whether it is physical muscle tension from a hard workout or a long run, whether it is emotional stagnation, like we kind of talked about, whether it's just built up heat and tension, then it helps to move those things. It can also release pathogens. So, I have a treatment that I do right on the back of the neck. That's where pathogens, like if you feel like you're going to get sick, that's where they enter. That's why
Mhm.
in Chinese medicine we love to wear a scarf to protect that from evils. But you can actually suck out the pathogen through that area and keep your illness from progressing. So there's a lot of different functions of cupping. It is like acupuncture is a little more tonifying and nourishing. Cupping is a
Mhm.
little more sedating. So if I have a patient who is, like maybe they're underweight, maybe they lost their period, maybe they're trying to get pregnant,
Mm.
things like that. If they are a deficient type of patient, I'm not really going to cup you. I'm probably not going to cup you the day before your period comes just because your
Mm.
body's already using so many resources and I don't want to take any of them. I
Right.
want to only nourish. Does that make sense? But cupping is
Absolutely.
great because it can sedate. So it can take things away. If you have too much heat in the body, too much anger, too much whatever we're trying to relieve, tension, then it will pull that away. And you do just feel this like weight off your shoulders. You feel lighter, you feel clearer. And it feels great. It's also really great for lymphatic drainage just because it removes, like I said, all those blockages. So then your lymph can flow more easily and more properly.
Yeah. So cool. I love it. I
I
love it.
love cupping and it feels like a
Yeah, it's so
massage.
fun.
I do moving cupping.
So
So
good.
yeah, it feels, I think people are scared of it because the bruises look like bruises.
It's intimidating. I mean, this medicine as a whole, I think, can be very intimidating, but it's I mean, obviously life changing. So
Yeah, that's why I love talking about it because it's
yeah.
really not scary. I'm scared of
No,
everything.
it's not. It's not. It yeah, it looks scary, but it's not. The only times I feel like I really maybe feel something is during acupuncture during my period, during my cycle,
Mhm.
because our bodies, as you know, are very sensitive. But other than that, I'm like, it feels like the computer is just getting a reset.
Oh, I love that. Yes, totally.
Mhm. Yeah. Can you share a little bit about acupuncture? Because most people think it's just needles going around their body, but there are certain places you put them for certain organs, right?
Totally. So in
Okay.
Chinese medicine, we work on the theory of the meridian. So the body is kind of a map. There are channels that run up and down your arms and your legs and your head and your back. Pretty much every inch of your body is probably connected to one of the meridians. The meridians are named after organs. So like on your hand, you have the large intestine channel, and it kind of runs up here. So if you have some chronic constipation or you have a gut bug or you have a problem with absorption or energy, because absorption means you have good energy, then I am going to palpate your large intestine channel. And even though it's on your arm and nowhere close to your stomach where your actual physical large intestine is, it is connected. And now there's like research that shows the innervations and why it all makes sense. But, Chinese medicine has known for millennia that it's connected. And it really is amazing the way that you can affect the body. If you have a digestive issue, I'm going to treat your stomach too. But even using only distal points, if you're like, I have, a history of whatever, and I can't have you touch my stomach, I can use your legs and your arms and treat your
Yeah.
stomach, and you will notice a difference. So
Mm,
it's pretty
so
amazing.
cool. So cool. What are some daily practices you feel women should incorporate into their everyday lifestyle to help balance their hormones and for optimal health?
Totally. So, in Chinese medicine, one of our biggest things is, and now it's a trend on TikTok, it's drinking hot water and just avoiding things that are super freezing cold. Your digestion is a fire, your adrenal, and natural energy origin is a fire. So, when you are drinking frozen smoothies, drinking ice cold water all day, you're dampening those fires and you're going to feel colder. You're going to feel lower libido, maybe you're going to feel all these different symptoms. Your period's going to be more painful because cold constricts and it like reduces the natural flow of chi that you need to have a painless period. So, warmth is huge. In that same vein, the kidney channel is connected to, the uterus and ovaries. So, to have a healthy period, you really want to keep your feet warm and covered. We don't do bare feet on cold floors, especially before or during the period, just because the kidney channel starts on the bottom of the foot. So just wearing socks for those
Mhm.
couple of weeks before your
Can
period.
help.
Yes, that is a huge recommendation. And like you said, warm foot baths, even better, like extra credit. So,
Yay. I
yeah,
got this they created these sachets on Amazon. I don't really like to buy this stuff on Amazon, but it had mugwort in it, and so I've been
yes,
doing those baths. And yeah, it's like a little annoying, but it really does help overall. My body feels so much warmer.
love it.
I'm
Yes,
70 of my feet are always freezing cold, so it's like crucial for to be consistent with those foot baths.
yes, totally. I'm sure there are more things. It's hard to like make general recommendations
Everyone's
to
different.
everyone, but for
Right.
people who have like any kind of PMS. So if you, especially estrogen dominant type symptoms, um, so that would look like you get breast tenderness before a period. Maybe you get extra irritable or sensitive, like crying and teary before a period, or like a PMDD pattern where you're super anxious or super angry.
Mhm.
Then, for all of those people, it really, really helps to increase your fiber during your luteal phase. So, that is the 2 weeks after you ovulate and before your period comes. It's the second half of your period. And especially raw carrots are great, but I love any kind of fiber. So beans are another great one. Just adding a couple tablespoons of beans to your meals for those
Mhm.
2 weeks makes a huge difference. It helps the liver to detox those excess hormones because it's usually a little bit of excess estrogen that's not able to come out. So I want that to come out.
Mm.
It comes out through a bowel movement. So we increase the fiber, and it makes a huge difference. People swear by it. Like patients send me in things that say carrots on them because they're like, you're like working for Big Carrot. Like I'm
Oh
like,
my God, I love it. I
I don't
never knew
like them that
that.
much, but they work.
Okay, I'm gonna eat so many beans and carrots. Like
Yes,
it's that's what the fridge is gonna look like.
love
Is
it.
there a specific kind of bean you recommend, like black beans, or it just doesn't matter?
Any kind of bean is great. Black beans and
Okay.
kidney beans are especially great if like you feel like, I mean, they go to the kidney. So foods that are black go to the kidney. So maybe extra credit on those. The only thing is I don't usually recommend garbanzo beans or
Okay.
chickpeas just because I notice people get more bloating with them. So those are not
Hmm.
my favorite.
Okay. Good to know.
Yeah.
I'm definitely gonna start doing that because I mean I feel like I've had a lot of different cycles with PMDD, PMS. Like, I mean, there was a point a couple years ago where every time I get my period, I was literally like suicidal. Obviously, I would have never done anything, but I was like, I want to die. Like, I
Yeah.
can't live like this. And I never knew our hormones shifted every week.
Yes.
I was like, and I got my period when I was 9 years old. Like, I got it so young, already had acne and stuff. And so I was like, wow, up until like maybe 2, 3 years ago was when I really actually started to learn about our bodies. And I'm like, this is not okay. It's actually infuriating that I
Wow.
lived like most of my life not even knowing, getting a period, not knowing what was happening to my body. And honestly, most women are in the same boat, which is also infuriating.
I hear all of that often and it's so frustrating. And I don't know why
Yeah.
this isn't talked about every day in, elementary school sex ed. I don't know. I don't have an answer
I
for
don't
that.
know. I mean, I feel like I do know, but that's a
Yeah.
whole other podcast episode to go down. Ooh, okay. What are your thoughts on yoni steaming?
Oh, interesting. So we did talk about that briefly in school for Chinese medicine. Um, I mean, it's not a traditional Chinese medicine. I believe it's more
Okay.
Ayurveda.
Okay. That was my
But
mistake then.
love it. I hear amazing things.
Okay.
People use mugwort for that as well, like you were talking about, which in Chinese
Mhm.
medicine moves the blood. It's like a really famous women's health herb. So,
Mhm.
yeah, love
Yeah.
it.
Yay. Okay, can you also share like just all the modalities within Chinese medicine?
Yeah, there's a ton.
Because there's
But
a
the
lot.
main the main ones would be acupuncture, herbal medicine, which includes herbal formula prescription, and now also supplements. And then cupping is a big one. Tui Na, which is Chinese therapeutic massage techniques,
Mm.
so like body work. And then moxibustion. So that is the use of dried mugwort and we burn it. There's a few different ways to use it, but we basically typically burn it like incense near the skin so it just feels warm and that warms the channels and can treat different things with that. Also acupressure, so that can be either through, I use a lot of magnets, like they're little stickers with a magnet on them and I'll put them on someone and say, here, this is good for your neck pain, leave it all on all week and it should help. Or you could do ear seeds, which I don't know if you've heard of, but they're cute little,
I
oh,
have them in right now.
I love it. Are they the gold ones?
I have one here and then one inside and then one on my tragus.
The ear is amazing. The ear is connected to the auricular branch of the vagus nerve. So using the ear and acupressure or acupuncture on the ear, you can treat the whole body directly through the nervous system. And it's amazing because usually when you put them on, patients will say, wow, I feel calmer immediately. And it's amazing. There's like 400 points on the ear. So there's a ton, but you can treat anything. You can treat hip pain. You can treat, a headache, energy, like literally anything you can think of. It's
So
amazing.
cool. Do you
Yeah.
have a favorite point on the body that you feel with acupuncture is just like most effective? Or is it a secret?
I mean,
It can
there's
be a
400
secret.
points. Let me think
I
about it. Yes. Okay. So one that I, was using before we started because I was nervous is
Mhm.
is on the
Mhm.
hand. It's called heart eight. So if you make a fist and you see
Okay.
where your ring finger lands, then you can
Mm.
massage that point. And that is really great for any kind of anxiety, insomnia. It's called a panic attack point. Like if someone is actively in panic or just, upset or nervous, you can massage this point and it clears the heat from the heart, which just kind of grounds you, makes you calmer, more confident.
Don't mind me if I'm just here every day, just massaging where my ring finger hit.
Yeah, it's
Oh
a
my
good one.
gosh, that's amazing. That's a great one. Thank you so much for sharing that.
Of course.
What is the biggest absolute no not to do when it comes to like women's health and hormones?
Oh, I mean, I want to say drinking iced water, but I feel like that's boring at this point.
No,
Uh,
but if it's true, I mean, honestly, I woke up this morning and got an iced coffee, and I knew I shouldn't have done that, but I was like, okay, well, at least I waited and I had some warm water, and then I did it.
that's fine. Yep, that's forgivable. My girlfriend drinks a nice coffee every morning, and I'm always like, "Can I please make you some hot water first?" She's like, "Nope,
Right?
I gotta do it." I'm like, you
Yeah,
know
yeah.
what?
No,
um,
I'm always trying to tell my girlfriend, I'm like, babe, like seriously, like I need you to like join this journey, join this train with me because it's going to be amazing for you. And you get it. Like we're working on women every day, both my partner and I, same thing. And I'm like, the energy that you can pick up from
yes,
meeting so many different clients and people, and we all have our juju. And so it's so important. I'm like, okay, we need to keep your body in balance, your mind, everything.
I love that.
She's over it. She's like, okay, just have them come to the house. Like,
I think that this is what probably your audience and the collective needs to hear is
mm,
you have to stop making everything your responsibility. It's not your responsibility to manage other people's emotions, to control what other people think about you. If you release yourself from that, it is freedom. It makes everything so much better.
where do you begin? I feel like that sounds so simple, but
Uh-huh.
I mean, it's so hard to not let what other people think about you affect you, or how to not care for other people and worry about them all the time if that's your
Uh-huh.
spirit, speaking about myself. But seriously, it's really not that easy. Where would you suggest someone begin?
No, I hear you. It's way easier said than done. And for me, it's like probably a lifelong journey that I've only just
Yeah.
begun in the last like maybe 1 or 2 years. There's a book called The Courage to Be Disliked. And have you heard of it?
I'm finished it. Yeah, it's great. It's
It's
great.
so good.
It's
I love that
yeah.
I also listened to it on audiobook. And it's like kind of a debate, between like an older
It's so
philosopher and a
easy.
young student.
Like you
Yes.
can totally just listen to it if you don't like to read because it's just two people
It's
talking.
a conversation. It's like a podcast,
Yeah.
like an old
Yeah.
timey podcast. That's what I tell my
Yeah.
patients.
Yeah.
So
No,
that's the
it's
book
great.
that I prescribe when I'm like, I need you to start somewhere, and this is a good place to start to just like,
Hmm.
just learning that not everything is your job because we really make
Yeah.
everything our job, and we think that
Hmm.
that is the right thing to do, and it makes everything so much harder.
Yeah, I've talked about this book because I love one example he gave, and I'm going to say it again because it's so powerful. He was like, "You do have the ability to control your emotions and how you react." And like the guy in the book, I'm like, "Yeah, okay." Like, and then the doctor used the example, or philosopher, I can't remember, used the example of he was like, "Oh, really?" Because like when you're a kid and you're in trouble and your mom's on the phone and she's yelling, and then someone calls and she's like, she's fine and she's not angry and not yelling at you anymore. You're like, I was like, whoa, that's so true. I
Yeah.
do have the ability to not get upset and not
Totally.
allow myself to get to like a certain point, but
Yeah, I love that.
it's
Yeah,
life
that book is full
changing.
of gems. I love it.
Yeah, that book is really good. I think I should reread it.
I
Like
need to reread it
clearly.
like every week. I get
Yeah,
it.
right. What do you think women should understand about the hormone shifts every week?
Yeah, so a lot of my patients find it really useful just to track their cycles. I mean, I have an aura ring which tracks everything for me. I love that. But you can also just do it with paper or using one of the apps. Um, I like the app Kindara. That's a free one,
Mhm.
Kindara. But just knowing what to expect, knowing that, during luteal phase after you ovulate, your energy might be, a little lower. You might, people say that they get like the uglies during their luteal phase. Like things are just going to feel differently. And it's because evolution is like, oh, you're not fertile anymore. Like, you're going to be tired
Yeah.
now.
Yeah,
And then you
exactly.
know that when you show up for your workout, you might be exhausted and it might not be the day for an intense workout. So it can be really helpful to track those and to kind of lean into it. My goal with these patients that have really, they'll come in during their luteal phase just like crying and they're like, everything is wrong. And then they come in the next week, they're like, oh, my period came in better. Like,
Yep.
your life shouldn't
Story
be
of my life.
so, like, your life shouldn't be such like whiplash just with these hormone shifts. So,
Exactly. And I didn't
my
know that. I
goal.
thought it was normal. Like I was like, yeah, people laugh about cramps and PMS all the time. This is normal. It's just a part of being a woman. No, it's not.
And that's what we're told. And MDs will even tell you that. Like, yeah, everyone gets upset or whatever. And unless it's that bad, then maybe they'll give you, antidepressants for 1 week a month. But that's, we're not treating the root cause. My goal is to get everything kind of leveled out. But I do think the first step is to just like track your cycle and be aware of what to expect. And that way you can tell. I have patients that are like, I get really anxious sometimes and then it just goes away. And I'm like, when are you getting anxious? When was your last period? Is this a pattern? And 9 times out of 10, it's a pattern. So just
Mhm.
knowing what to expect, knowing, there's a few different things. A lot of my patients have histamine intolerance, and I'll put them on Pepcid AC, which is famotidine, which is an over-the-counter, conventional medication. But for patients, like you said, who are like crashing out absolutely before their
Yeah.
period, I'm like, Pepcid AC will kind of lower that histamine that is giving you this severe PMDD. And until we can treat it, that's my band-aid for you. And that will
Mhm.
work. Or
Yeah.
if someone's like
Yeah.
not open to acupuncture, that's a free tip for you. That it really
Yeah.
does work for people.
Also, too, I wanted to touch a little bit on the luteal phase because it's something a lot of people talk about. Do you think that there is a correlation? Because I feel like oftentimes every month for myself, and typically for most women who are experiencing PMS, it's the same kind of thought pattern that comes up or the same type of anxieties.
Mhm.
And I was wondering if you think there's just like, what do you think about that, honestly?
Yeah, so there's a few things at play. Um, when you say the same type of thought patterns, are you like, what's the cause of that?
More so like, I think maybe there's a connection I feel between suppressed emotions and then obviously just overall body imbalance. And I
Oh,
think like I feel if you don't express those emotions properly or maybe deal with those issues, that it's kind of going to keep just coming back regardless of what medication you're taking or what herb you're taking, something like that.
no, no, that's great. That's helpful. So the liver's job is to circulate chi in the body and also kind of move emotions. So emotions are chi energy, and those all, like I said, they need to be coming and going. And when the liver is overwhelmed, which is going to give you luteal phase symptoms, luteal phase is kind of when the liver's most stressed out because it's supposed to be detoxing this estrogen before your period, but it's having a hard time because it's busy with all your
Mm,
stress and all your emotions and all these other things. So the emotions kind of get stuck and they come up in the worst ways. And usually that's why people are prone to the irritability, the frustration, the anger. But there's other things that can come up too. Like I said, the liver has that relationship with the spleen. The spleen's emotion is overthinking or pensive anxiety. And that's like that circling thought pattern that you can't get out of, that pensiveness and rumination
yeah.
where you're just like, oh my God, get this out of my head. Like I'm done with this.
Yeah. Yeah.
But so different things can come up for different people. But yeah, the goal is to clear that liver of all of its stagnation so that things can just come and go and things can feel easy. Your emotions should feel level. They should come and go. It should be a moment in time. It shouldn't
Mhm.
be this like thing that haunts you and that you stuff away in
Yeah.
your body.
And you don't need to feel that way either. I feel like again, we're kind of just taught that women are crazy our whole lives and very emotional and dramatic. And
Yeah.
I think I because of that as well, we can tend to kind of feel that way ourselves, but you don't have to feel that way. And TCM made of me feel like a normal functioning woman for
Yes.
the first time. And yeah, I feel like I'm like I feel like I sound like a soapbox, like somebody who's like standing on a soapbox because I just want to like shout it. I'm like, guys, like you guys don't know about this and you need to.
No, I love that. Yeah, I love that Chinese medicine gave you that. And that's what I love doing is I love these patients come in and they're like, "Oh yeah, wait, why do you care about this random symptom? Like why do you care that I feel like, my teeth hurt sometimes or random things." And they're like,
Yeah.
"My doctor would never care about that." But I
Yeah.
do because it's all connected and it's all coming from somewhere, and I'm never going to dismiss any of it. I'm never going to tell you that something is just because of stress. Like I'm going to tell you, "Oh, one of your organs is out of balance. Let's balance that. Let's get that
Hmm.
feeling better. I want to see all of your symptoms like
Yeah.
significantly reduced, if not gone."
Yeah. A follow-up question to kind of like what we're talking about now. I'm curious on your thoughts on hustle culture and obviously, of course, how you're seeing it affect your female clients.
Yeah, I see a lot of burnt out, high performing women.
Yeah.
And, I was one myself. That's how I got here. I was trying to create
Yeah.
like a softer life for myself. And then
Yeah.
here I am running a business now, and it's not exactly that all the time, but definitely a lot more so than, when I used to wake up and I went to Barry's at 5:15 every morning. And then I would get on my emails at 6 a.m. Like, I can't believe I did that for so long.
I know. Isn't it crazy? I told myself, starting last year, implementing that into the year, I was like, I'm gonna do my best to live life as slow as I can, as slow
Yes.
as possible.
Yes.
Oh my gosh, how many times I have to remind myself that not everything is an emergency is crazy. I wasn't fully aware up until, recently how much hustle culture affected me, even though I'm not somebody who has a 9 to 5. It's really crazy. It's just like you're always like, okay, on to the next thing, on to the next thing, on to the next thing.
I love that you're saying that. I call my friends and my girlfriend out on that all the time. My girlfriend will be like, "Okay, I'm just gonna shower. I'll be so fast." I'm like, "Why are you gonna be so fast? Where do we have
Yeah,
to
you
be?
need to.
We're gonna watch TV. Like, it's gonna be fine." I was like, "Take your
Literally.
time." I mean, slowing things down and feeling like one mantra that I tell myself all the time is I have plenty of time. And that
Hmm.
to me is nervous system regulation because that's what's been
Yeah.
taken from us. We're inundated with like constant information, constant bad news, constant like just feeling like everything is a rush. People talk about traffic and how they're always late, and like we feel like we don't have enough time. And
Yeah.
then your body's in fight or flight all the time. And that's the price that we pay.
Constantly.
And
Hmm.
nothing is that serious. Like almost nothing is that serious. And it's just not worth it.
Truly. Yeah. Like, unless it is an actual emergency, it's not an emergency.
Yeah.
Simple as that. But I also think, all of this stuff that we're talking about, especially the nervous system regulation, it's all cognitive work. How do you suggest somebody begins, with that constant reminder?
Yeah. I mean, for me, this is something that I struggle with too, for sure.
Hmm. Hmm.
Um, I mean, clearing out space in your day just to do some output. I feel like we have so much intake. I feel like, we're always
Hmm.
playing TV in the background or we're always listening to music in the background, and it kind of like is overstimulating, really. And it's escapism
Yeah,
at a certain point. Sorry to say it so
absolutely.
bluntly
No,
to
it's true.
comprehensive,
It's
but a lot of
absolutely
people
true.
do that. So, quieting that down, giving yourself time to, journal or do talk therapy, whatever it is that you are doing some output. People make art, like whatever that is. You can sing in the shower.
Cooking,
Yes.
anything. Yeah.
Whatever your like creative thing is, doing that and making space for yourself so that you can see like what your interests are and who you are and spend that time with yourself to get to know yourself and what you actually care about.
Most people nowadays don't even realize it, that they're just trying to
Um,
avoid an uncomfortable feeling or an uncomfortable thought. So they pick up a phone and they doom scroll, or they're having working while they have music on in the background because they don't want those emotions to come creeping back in.
uh-huh.
But then it goes back to what we were saying in the beginning, how important it is for every emotion you feel to just finish its cycle.
Yeah. Oh, I love that language. Yeah. Yeah, I mean, we've gotten really good at avoiding them. Like our phones are the perfect way to just hide from
Yeah.
those emotions, and like your brain moves past them, but your body still has all of them stuck inside of you. And then they're going to come out eventually, or they're going to give you symptoms. So, yeah, you got to like you said, finish the
Yeah.
cycle and give it an exit point. And that's what I do with acupuncture. That's what I say. Patients will be like, "Oh, why is that point on my wrist like kind of achy?" And I'm like, "That's
Tender.
an
Yeah.
exit point for grief and sadness and issues with control." And that's where it's all leaving your body. You can do that with acupressure. but everything's been stuck in there for so long. I'm finally letting it go. I'm
Yeah.
telling it to get out because you
Yeah.
can't keep holding on to it.
Yeah, I can almost guarantee if you're avoiding emotions, suppressing them, hiding them, whatever you want to call it, your health probably isn't great and you're probably not in a healthy relationship. And that's the truth. And that's, I'll
Mhm.
say it because I'm an Aries and whatever, but I have to just say it how it is. And it's true. That's like one of the other, I feel like, keys to life is to just not suppress how you feel and
Mhm.
let thing I saw this video on Instagram. I think I talked about it in the last episode, but like you said, emotions are supposed to be fleeting. I think of them like waves now. I'm like, okay, this is passing through
Mhm.
me rather than I am. And I saw this other video talking about how the English language is like causing us to have negative mindsets. And I was like, wait, that's so true. Because why are we identifying with something that's not permanent or
Yes,
not
I
like
saw
a
that video
label?
too. I love that.
Yeah.
Like we say,
Love,
I am
love.
angry. In other languages, they're like, I have anger. Like I'm
Yeah.
dealing with anger. Like
Yeah.
that's the
Or it's
correct way to
passing.
think about
Yeah.
it.
Yeah. I'm just like, I mean, there's so much. There's a whole rabbit hole, of course, but it's just so crazy.
I love that.
What do you feel like is the number one sign that your body is asking you to slow down?
Ooh, hard to pick one. Okay, so if you're
Yeah.
having trouble relaxing your mind at night, your body doesn't feel safe. If you are having tension on your shoulders and up to your neck to your jaw, or getting jawline acne, that could be from the lymphatic drainage or the lymphatic clogging that's coming from that muscle tension, then the tension that lives in this area is like fight or flight. Your muscles are tense because you're ready to run from the bear
Yeah.
that's not really there.
Yeah.
Digestive issues. If you feel like your digestion just doesn't work and it doesn't matter what you eat and you're always bloated, or like things just aren't working properly, nervous system dysregulation, that's a big one.
Mm,
There's a couple other, like there's a specific pattern of histamine intolerance or MCAS where people get like skin issues like rashes, eczema,
yeah.
redness on their skin. I'm seeing that a lot recently. Um,
So I had like an eczema patch right here. That's what I love about what you guys do as well,
yeah.
because there's a reason for everything. And I think especially as women, we're always kind of searching like, oh, why is this happening? And typically we can't find that. But with this Eastern medicine, there truly is a reason for everything.
Yes, because the body is a map and because there's always like something that you can trace it back to. I have all of these different ways to think about any disease or symptom that someone brings into me. And sometimes the case is really complex, but there's always a direction to take it. Your body is always giving you clues. You just have to know how to read them.
That and that is so important. Your body is giving you clues because it really is not just like, oh, just take this and it's fine. Like it's a whole system. We're human beings. If somebody wants to feel more aligned with their feminine energy, how would you suggest they start today?
Oh, I love that. So in
Mm,
Chinese medicine, with yin and yang theory, then yin is the more feminine, the more receiving, the more, cooler in temperature side. So that is the side of substance and the side of, like, well, yang is masculine and bright and fire and rises upward. Yin is grounding and more creative and more, just more deeply rooted than yang. So to cultivate yin, and yin also is the Chinese medicine approach to beauty. So all of the things that, like, we want like plump healthy looking skin, we want beautiful long thick hair, we want like beautiful dark eyelashes, like things like that people think about that they want cosmetically. Those are all manifestations of having a good yin reserve. So some foods that you can eat, I do a lot of food, I call it Chinese food energetics, because it's
okay.
not really like, don't eat this instead. It's more like, try to eat these foods that have this quality. So it's foods that are high, they have a high natural water content, or they have like natural fats in them. So foods like fish, natural fats and salmon are really great to replenish yin. And then salmon and seafood is also from the water. So water, of course, is very, very yin.
Mm,
Drinking enough water in general. Um, so kidney is the root of all yin and yang in the body. So to nourish the kidney to make sure that you're able to make enough yin, then you want to make sure that you have enough salt actually in your foods. So using a high quality, maybe like a Celtic sea salt or Maldon sea salt is a good way to make sure that your kidney is well nourished and you can make enough yin. What else is great? Oysters are amazing. Oysters are like one of the most yin foods. It's also a natural aphrodisiac.
mhm.
Um,
I'm
like
like
a
so afraid right now because of people dying from them. I'm like, okay, I'm okay.
Wait, was
I
that in
that
the news
can't be the way
recently?
that I die, so I won't risk it.
Well,
I
I mean,
just
you
can't.
can cook them, but yeah.
Oh,
I
oh
hear you.
yeah, that's true. That's very true.
No, that's so fair. No, there are so many other ones because a lot of my patients are also like, vegetarian or have dietary restrictions, whatever. So really anything that is black or dark purple goes to the kidney. So like before we talked about black and kidney beans are great. Black rice, like forbidden rice. Um, Black salt is, like double A plus because of the salt aspect.
What about
Um,
sesame seeds?
Yes, black sesame
Okay.
seeds are famous for hair health, especially like if you feel like you have early graying of hair. I also
Mm,
recommend those often for other dryness issues in the body. Like they're so easy to just add into everything because they're kind of flavorless. You can just I mix them
yeah.
in eggs or whatever. Like you can put them on soup, anything. But they also help to nourish the yin if you are someone who like has really dry skin or dry eyes or dry like constipation. So
Hmm.
kidneys or black sesame seeds are amazing for that.
Hmm. What's your favorite like go-to traditional Chinese recipe, but that can also make you more beautiful and enhance your natural beauty? Do you have like a go-to recipe?
Yeah, I love cooking my fruits, and then you can add in there's something called tramella mushroom, which is actually white
Hmm.
snow fungus, and it gets really gelatinous and like it doesn't taste anything or look anything like what you think of when you think of a mushroom. It's not like a portobello. It is like this beautiful jelly, like it looks like a sea creature,
Hmm.
honestly. But you
Yes,
cook it
I
in
love
water.
tremella. We'll put a picture. It's great in skincare besides ingesting it, but it's amazing.
Exactly. Yes, it's also
Super
like really
hydrating.
naturally hydrating for the skin topically as well. You're so right. And you can put in some black sesame seeds in there. You can add in some goji berries, add in some honey, and that is such a good dessert. It's like a Chinese
So
medicine
good.
dessert that will just leave you glowing and looking like you slept 8 hours.
Oh my gosh. Okay, so I'm gonna have to reach out to you for the recipe to share it with
Sure.
for the femmes because that's a must and I definitely need to try it myself. So of course there's always a fear that queer patients will be treated differently, in the healthcare space and that's very different for you. So I was wondering how you treat your queer patients.
Yeah, so I love being a safe space for my patients. I've had the experience at the gynecologist or wherever where they're like, could you be pregnant? And
Mhm.
they just ask all these questions, or you're like, I'm not sure if like do I have to like come out to my doctor right now? And it just
Yeah.
feels so weird. So I love that my patients don't have that worry with me. They see on my profile, and I think a lot of my queer patients do come to me because I'm queer and they know that I get it.
Yeah.
But yeah, I love just
Hmm.
letting that not be an issue in our treatment.
Yeah.
Like you're already coming in with all these symptoms. Know that I see you for who you are, and that's not like I'm not gonna hold anything against you. I'm not gonna like
Mhm.
ask any stupid questions because I get it and I see you and I
Yeah.
am you. And that's just another like
Mhm.
piece of how I can help them.
Yay, I love it. Okay, so I have a little segment at the end where I ask all my guests, what are your three favorite things right now? It can
Ooh.
be a makeup product, something Eastern medicine related, or a book, anything. What are your favorite things?
Ooh, okay. So I recently have been getting eyelash compliments because I love the Ilia. It's ILIA
Okay.
mascara. Have you heard of it?
Okay.
It's in the
Yes,
white
I
platform.
actually used to use it. I like that one a lot, and it's
I love
clean.
it. Yes, it is. So that's something that, my patients have been like, send me that link.
Yeah, yeah.
So shout out to Ilia. Um, what else do I love? Um, the Erewhon chicken vegetable soup
So good. So good.
is like
Erewhon
I
period is like favorite things.
unfortunately yes.
Yeah. And not because it's like so LA, literally because the quality of the food is fantastic. You don't
It's
have
just so
to like
good.
think twice when you shop there, which is so nice.
Exactly. I used to live down the street from one and I was like, okay, we have to stop going every day.
I know, it's crazy.
What else do I love? Um, oh, there, let me show you. This specific incense I get compliments on all the time. I use it in my clinic and I burn like half a
Cool.
stick between patients just to kind of
Mm,
clear the energy.
mhm,
This flavor is osmanthus. It's by the brand Kairagi. And
mm.
osmanthus is a flower. It smells so good. It's not smoky at all. It is
Yeah.
the perfect smell.
Oh my gosh, so good to know. I love that. I always burn Palo Santo in between. I'm so big on scent, especially just like fire, everything. I'm like, I love it.
Yes,
So good.
that's so nice of you.
Right, I know. I'm such a fiery person. Thank you guys so much for tuning into this episode. This was so special. Thank you so much for joining and sharing your knowledge. I will link all of her information. So if you want to book an appointment with Dr. Jack, you can. And we'll see you guys next time. Please like, rate, share this podcast. Thank
Thank
you.
you so much. It was so fun.